Hi guys, so as promised for this site change video, first I want to say Happy Easter everyone. Okay, so before I start with the whole site change, I tested my sugar and I was at 107. They recommend that you test your sugar before and then that you test it 2 hours after. Okay. Sorry about that. So to start with the site change, take your pump off your belt or your pants or wherever you have it hooked onto. And then you will scroll down to, I don't know if you can see that with the webcam or not, probably not, reservoir and set, and then you'll go up to reservoir setup, and it'll tell you to disconnect. Let me back up. Alright, so I am connected right there, and I disconnect so no bubbles or anything will go through while it's rewinding. So we'll let that rewind. And I will remove the old site. Pull on it, there's medical tape. Alright, this, let me bring it close, there we go, is the cannula. It is very short. It is about 1/8 of an inch. Alright, it just beeped at me. Let me know it's done rewinding. And then I disconnected the pump back to the site, but it's not on me. Pull the reservoir out. Okay. Secondly, insulin in the new reservoir, and 2 alcohol swabs or IV prep. I haven't received IV prep. I don't know what's going on. The nurses told me that they were going to get some for me because it makes the site stick better. But I haven't had any problems with the site. And then your infusion set. I use the Mia. Okay, so you're going to open up your insulin if it hasn't been opened. This is a brand new bottle. And with brand new bottles, you don't have to clean them when you open them first, but the next time I use it, I will clean the top of it off. Okay, so open the reservoir and pull the little plunger down to 3. And now I use it at 3 because of pregnancy. My demand for insulin is a lot more than what it was before I was pregnant. And put the reservoir on your bottle of insulin. And push the air in. And this is what I like about using a new bottle. Is as soon as I let this go, it starts to fill itself. This is only with the first use of the new vial. And then you'll have to help it. But it fills itself most of the way. Alright, and then you probably can't see this, but there's a bunch of bubbles at the top. Excuse me. We're gonna push those things out. Now little champagne bubbles are fine. The bigger ones are not. Okay. Then you take your bottle off. And this little blue thing comes off too. Twist and pull. And you want to put your reservoir back on a sterile surface. Alright. Now the Mia. I love these things. It's your infusion set all in one. And I don't know. I just love it. That's all I think. So I pulled the safety wrapper. Then I pulled the second safety wrapper. Pop the top off. Then there's my tubing. And unhook it. And go all the way around until it stops. Then there's a little notch to rest the tubing in. Then you pull the needle guard off. And the paper protecting the medical tape. Okay. Now, next, the reservoir in the site. And then twist until it clicks. There. And then give it a tap or two again to get the bubbles out. And give it a push. A little one. And the plunger twists off. Okay. And then you're going to put your reservoir into your pump. Turn until it clicks. And then you'll hit the act button. And it'll say place the lock reservoir, then hit act. I already did that, but I'll hit act now. It'll ask you if you're disconnected. This pump goes through a lot of safety features to make sure that it's done right. Okay, so now I'm going to be filling the tubing. And I've been told to hold the pump up so that whatever bubbles are left in the reservoir, if any, will get flushed out. Oh, and by the way, I've been told to keep my insulin vials at room temperature. It creates less bubbles. You might be told differently, that's fine. That's what I've been told. Alright, so here we go. Okay, you see the bubbles? Alright, it asks if I see drops. There it is. Okay, now it's telling me to connect it to my body, then hit act to fill my cannula, which is on top of this little needle. Yes, there's one needle, but better than having to inject with a bunch of needles 4 times a day. So I cocked and locked my Mio. I'm only using one because I said I opened a new bottle of insulin. Alright. Then I will get up and show you guys. I was on this side. Now we're going to go on this side. And I have to go a little further back because of my pregnant belly. Right. And then go in a cool spiral type thing. And start that off. Yeah. I always clip my pump before. Alright. Now, on the Mio is a little arrow thing, and that's the tubing. It's going to be facing. If I put it this way, the tubing will be facing this way. If I put it that way, the tubing will be facing that way. That's how I like it. Alright. So then there is two finger grooves. Two sets of finger grooves. One of them has grips on it, the other one doesn't. The one without grips does this. Insert my camera. And then I pull, and voila. Make sure the tape stuck. And then I hit X and fill. And that is it. It's painless. I like this pump. Other people may use the Omnipod, the Ping, an older model, but this is the model for me. I was going to go for the Ping, but my insurance didn't cover it. So, deal with what they give me, and I love this one. What can I say?